you've ever been in nerve pain or dealt with nerve pain, then you know it is a serious and crazy issue. And that's why we have Dr. Ashley on the Movement is Medicine show today to break down nerve pain and share a little bit about some of the unique ways that she goes about treating it here at the clinic. Dr. Ashley, what's up and welcome.
What's up, guys? Feels good to be back on the pod.
Love having you here. Thanks for carving out some time for us.
Absolutely.
Especially to talk about nerve pain, which I know is something that is near and dear to your heart, something that you specialize in. It's one of your areas of expertise. And it's one of those areas that it seems like there's a fair amount of confusion and misconceptions out there around what it is, what's going on with it. A lot of people self-diagnosing nerve pain when maybe they don't actually have nerve pain. So maybe let's start off kind of broadly with, like, how do you define nerve pain? What is nerve pain? And let's get into kind of maybe how you get a sense if that's what you're dealing with.
Totally. When I treat nerve pain, I go into it with the perspective that I'm basically trying to pick apart the relationship that your nervous system has with your musculoskeletal system. So basically your nerves and your muscles. And that's kind of where I sit. So when we're talking about the nervous system, you obviously have your central nervous system and you have your peripheral nervous system. I do more of work in our peripheral nervous system. So I'm talking about nerve roots, which start at your spine, and then the nerves that travel out into your arms, your legs, your hips, things like that.
And how would you differentiate? Because couldn't somebody say, well, yeah, I mean, doesn't all pain travel along the nerves? So how would you differentiate, I guess, nerve pain and a treatment methodology, which something like clinical neurodynamics, which is kind of the nerve treatment methodology that you're an expert in. Like, how do you differentiate that between, say, like muscle pain or muscle soreness or joint pain or something?
Totally. I mean, it can get really confusing just because we're dealing with multiple different tissues. So we're dealing with the nerve itself, we're dealing with the adjacent muscles, and we're also dealing with the interface, or also known as your joint, right? So we're trying to figure out, okay, where is it coming from? And a lot of the times your pinpoint and spot-on diagnosis is just going to come from the diagnostic tests that you use. And within this clinical neurodynamic realm, there are diagnostic tests specific to, certain conditions that a patient might present with. And we're doing those diagnostic tests every day in practice. And for any person, everybody is different. And people with nerve pain can also present with a negative test result, right? So we're differentiating between three different parts of one big system, and really nailing the diagnosis is going to determine how we manage a certain type of pain. So patients coming in and self-diagnosing or, going on Dr. Google and trying to figure out what their symptoms are can really muddy the waters, because if we're not nailing where the pain is coming from, it can really make somebody worse. So really nailing your diagnosis using those tests is super important.
Yeah, there's always, I mean, it's great, obviously everybody's going to do some research, and you are in your body, right? So you're going to share your experiences there. But I think you're bringing up a great point, which is, there's a systematic process to testing, validating, and diagnosing, what the particular issue is. Because sometimes oftentimes they're interrelated, right? So there might be multiple systems interacting that's producing a set of pain or immobility or issues for a person. And you're kind of using that diagnosis to kind of deconstruct, root and then referral pain perhaps, or how those things are all complicating each other. So it can be a little bit of a puzzle.
Absolutely. Yeah, it's a long process. It's not an instant gratification type of deal. It takes a lot of time and it takes a lot of patience. And, sometimes the odd case where I treat somebody one time and they feel 95% better. And sometimes I get the odd patient that comes in and they feel 10 times worse than what they did when they came in. So it's a long road, and really just making sure that you are doing the proper things and doing the proper exercises and preventing all these things too is really, really important.
So I imagine nerve pain, just like many other kinds of pain that we treat here, there's probably some similar causal factors, and
Totally.
overuse, or it could, maybe a traumatic event. Do you want to just walk through what are some of the most common things that you see contribute to or create a situation where nerve pain is the issue?
Yeah. You touched on it really, really nicely there. Nerve pain can come from multiple different situations. In my practice, it comes from a lot of like repetitive overuse types of things. And that can be repetitive postures sitting at a desk. That also can be repetitive movements like weightlifting or doing anything overhead, things like that. So there's a multitude of different things that can create it. I mean, obviously you can have your genetic causes as well, and things like that. But most commonly it's going to be that repetitive overuse, or it's going to be that prolonged position.
In nerve pain generally shows up with a specific flavor of pain.
Totally.
Right. So a lot of times when you're kind of helping to diagnose, you're asking, what does it feel like? And what would a person who's experiencing maybe a more nerve pain related thing, how would they describe it?
I mean, most commonly you're gonna get a shooting type of pain, maybe something stabbing, something that can additionally be numb or tingly. In worst case scenarios, people might also be noticing progressive weakness in their muscle systems. So, it can present in many different ways. It can also be a pinching type of thing. But most commonly, you're going to get some kind of radiating symptom, and then that one of those nerve qualities associated with it, whether it's shooting, burning, numbness, or tingling.
Okay. Yeah, that makes sense. That all vibes. Okay. And then when it comes to diagnosing or deconstructing what's going on there, I'm sure there's a system within clinical neurodynamics that you take people through. You want to give us a little light overview on what that looks like?
Yeah. So when I'm trying to pick apart a nerve problem, at the root of what nerves can withstand, nerves typically do not like to be tensioned, or elongated, so to speak, and they also don't like to be compressed. So those two things, when I'm doing my diagnostic tests, I'm trying to figure out if there's a tensioning problem, if there's a compression problem, and normally they play into one another, right? So too much compression on a nerve can also cause tension, and too much tension on a nerve can also cause compression somewhere else. So typically that's what I'm looking for. And the tension and compression can happen in multiple different areas. So, for example, carpal tunnel can happen at your wrist, or any kind of like neck and arm pain. It can be stemming from the nerve root in your neck, or it can be coming from the interface of that shoulder joint. So it presents in multiple different ways, but really just looking for a tensioning issue or a compression issue in that nerve system.
So number one is we're going to kind of diagnose, identify, kind of really lean into and click into and understand, what's that combination of the nerve being either, compressed or being stretched out, is it getting squished, and then where in that where along that movement chain or that system chain are we most likely seeing the problems? And then from there, once you have that diagnosis, I'm sure there's a variety of techniques that, within clinical dynamics that you can leverage, probably more than we could even go through on this show today. But, if you were to highlight some of those more common, treatment methodologies or treatment types that you're going to do then after diagnosis, what do you start getting into?
Well, I don't like to treat clinical neurodynamics as a separate kind of I mean, it's a separate train of thought, and school of thought, but I do like to combine it with multiple different types of modalities and passive modalities and things like that. And here at our clinic at Head to Toe, we like to focus on our 3 R's, our repair, restore, and rebuild. So if we're talking about our repair stage, I'm basically going to take a patient through a bunch of tensioning and sliding techniques, essentially just trying to repair the nervous tissue itself. And normally I combine that with a lot of soft tissue manual therapy work, whether it's laser or cupping, because we want to make sure that we can reduce any type of tightness or any other outside musculoskeletal influence on those nerve tissues initially, so we can get you out of pain. Moving into that kind of restore phase, we're going to start mobilizing things, or we're going to start to to move the patient and move those interfaces, meaning the joints. We're going to start moving you around a little bit more. And by that time, the subjective pain levels that you're experiencing would be at least 90 to 95% better. So you're going to feel better already just moving around. And we do want to make sure that the nerves are able to slide and move around those joints. So we're going to restore your motion, and kind of transitioning out of that, we're going to start rebuilding your actual muscle strength. So just kind of restabilizing, all those joints that were once affected, and just making sure that you can move confidently. I think the rebuild piece is also a mental piece, and that we want to reduce any sort of fear avoidance behaviors, because a lot of times after nerve pain, people can be really afraid to move, and this process takes a long time. Can range anywhere from a month to maybe even 6 months. So really kind of retraining those patterns mentally is going to be part of that rebuild phase too. So we're not just looking at nerves, we're looking at the whole thing. Like I said, the relationship between the nervous system and your actual muscles, and putting it all together really to just kind of bulletproof your body a little bit.
Sounds to me like this is a very personalized plan that we get into, looking at the techniques that are going to be the most effective techniques, then looking at, depending on the severity or, the intensity, the number of different issues that, you might uncover during that diagnosis. If it's a simple solution, we have, we'll go after that. But oftentimes, we're going to put a person onto a program that's really designed really specifically for them, where they are in their life right now, and look to address as many as those causative factors as well as those issues that, like, once they're out of pain and once they're kind of moving well again, how can we make sure we prevent that from happening in the future?
Totally. And with the nervous system, I mean, it's so adaptable, right? And it's adaptable to both positive things and negative things that you do to it. So taking somebody through a program like this is actually really great, because it's just retraining that communication between nervous system and the musculoskeletal system. And chances of reoccurrence, I mean, I can't tell you 0%. I mean, chances of something happening again is inevitable, but by taking somebody through something like this, you really build that resiliency, both in mind, mentally, and also just physically, because, I mean, who wants to go through nerve pain again? So my biggest part in all of this is just building somebody's educational and mental stability with it, and also just building that kind of prevention piece and resiliency, like I said, in their body and their tissues.
That's phenomenal. I think it's a missing piece of the puzzle for a lot of people, in both in what they're thinking that they need right now, but then also in practitioners. It's like, yes, obviously we want to get you out of pain as quickly as possible. And then from there, we really need to start looking at how can we make sure that we keep you out of pain, and also give you back, to your point, that freedom, that sense of confidence, that sense of your ability to move, that empowerment that, you're going to be okay, and that you can get and go do the things you want to do, and you don't have to be afraid.
Totally.
And that's a process that can take a little bit of time, but can be really effective, because we can build a very, very tight, very efficient, very, impactful plan to get you there.
Absolutely.
What would you say? So if a person's hearing this and they're maybe dealing with nerve pain, or they're thinking about getting help, what would be your recommendations on next steps?
I touched upon this diagnosis piece earlier. Your biggest first step is trying to figure out what's going on. And it doesn't matter if you're coming into our clinic, or you're going to see your PCP, or you're going to a physical therapist. You really just want to get down to what's going on. So whether that's us or somebody else, just really get your ducks in a row, so that you know what your next steps will be. Because if you're led in the wrong direction, things could just worsen, and your solution could be very simple. But I will also say this: clinical neurodynamics doesn't necessarily work for every person. So if you're looking for something that's if you have a diagnosis already and you're looking for something that's kind of more along the lines of self-management, I think this is for you. But if it's not something that can be treated with clinical neurodynamics, then you got to go a different route.
Yeah, and that's one of the things that, we help patients figure out here as well. If we need to refer into a medical team. You know, we're big believers in a kind of a medical team approach. You know, we have a team of doctors here with like a variety of different specialties, but then also outside the clinic, right? We look, ultimately, our mission and goal is to take a patient both through their interactions with us here, but then also to put them on a path to find the right provider, because that can be really challenging. You know, if someone comes in, we're able to help them say 50%, but there's still another 40% or 45% that we can't help with, but we can then help guide to that next step of the journey to get them what they need. Then, you know, obviously we're here to do that as well.
Absolutely. I mean, I'm totally biased with head to toe. Come in, book an appointment, come and see me if this is what you are experiencing, and we'll make sure that we put you on the right track.
I love it.
Figuring it out.
I love it. Ashley, thank you for being here. Thanks for sharing your passion, your expertise around this topic. Yeah, and again, if this is something that you've been dealing with for a long time, or we have patients who come in who have seen 20 plus specialists in a variety of stuff, and they come in and they're desperate, and it's like, oh God, I wish I would have found you guys 10 years ago. We also have people that have been dealing with this for a shorter period of time, but long enough to where it's impacting their life. And so, Ashley, what would you say in closing? What's a good gauge to know if you should come in or not? A day, probably not. Like maybe give it a couple, but maybe a year would be too long where you're dealing with this pain. So what's a good range or recommendation you tell people?
I wouldn't necessarily put a number on it. I would mostly just focus on the quality of your pain. So if you notice that it's changing into any of those kind of nerve type pains, I would definitely come in. And obviously if it worsens, I would certainly come in as well.
Excellent. Ashley, thank you. You can book online with Ashley. Give us a call at the clinic. We are here to help you feel your best, because at the end of the day, we believe that movement is the best medicine. Thanks, everybody.
Thanks, guys.